Hi guys, this is part 4 of a series of different questions that we've been kind of covering. I had a lady named Mary, as you guys know if you've been watching the series, she emailed me some questions and I wanted to specifically answer her email directly because I've had hundreds of emails that have came in over the last couple months here, essentially asking very similar questions. So part 4 of this, well, what I want to make sure that we cover here is that now that you've seen your conventional doctor and now that you've decided that you're coming into a naturopathic doctor, how do you combine those therapies so that it doesn't upset your conventional doctor? The therapy that you're receiving is kind of the best of both worlds, and how do we achieve that, and how do we go about doing that? So when you come into myself being a naturopathic doctor, what I'm going to do, just like every naturopathic doctor is going to do, is we are going to look at your biopsy report. We're going to look at your blood work and your scans and everything that your conventional doctor has either done, or we will get it done for you, and then we will get those records over to your conventional doctor. So we're all on the same page. Now, how do we work with your conventional doctor with the therapies that we're recommending, which are obviously different from what they're recommending? That is going to be completely based off of what is your diagnosis and what is the treatment that they're recommending and what I'm recommending, okay? So let me give you an example. Let's say that you are a cancer patient, for example, okay? This lady comes in to me, she has breast cancer. This was a patient of mine yesterday, actually. She had breast cancer. She had got some of her initial stuff done with her conventional primary care doctor who referred her to a medical oncologist. She came over to my office early in her diagnosis and said, Dr. Brown, I haven't really started anything yet. I heard about you through a number of people, and what do I do here? Do I do chemotherapy, radiation? Do I do this? Do I do this? Or what do you have to offer me, and how can we work in conjunction, okay? My philosophy is this, is that always be honest with everybody that is involved in your care. And so the therapies that I would recommend in that case could range from anywhere from certain injections to certain vaccines to certain IV therapies, from a diet protocol. You know, we usually go over at least a 10-day diet protocol with people. We put them on certain physician grade supplements, which I pulled this page up here so you can kind of see some of this stuff. So depending on the diagnosis that someone's diagnosed with, my therapies are going to be different depending on how I need to treat that person and what I need to do. But what I will be doing is I will be administering these therapies on certain days or at certain times, which will be away from the conventional therapy depending on what that therapy is. So ultimately the answer to the question is it depends on your diagnosis, what treatment your conventional doctor plans on giving to you, and what therapies I plan on giving to you, and then how do we blend those two together on that time frame. So once I have all your records and we know what we're doing from their side of the fence and my side of the fence, I will then lay out a complete step A to step B to step C, kind of A to Z plan here for you on how we achieve that and how we go about that. Everything that I will outline for you, I will give you paper copies of, and I want you to not only take that to your medical doctor, but I will also be forwarding copies of that to your medical doctor so they are on board and on the same page of knowing exactly what I'm recommending and doing in conjunction with what they're doing. Because again, the ultimate goal is about getting you well. And so I need to make sure that I'm looking at the entire kind of spectrum here of what can we do from all sides of the fence at the same time in conjunction where everything is working together to get you well. So that's how we go about doing it. We need to figure out what is the diagnosis and what are the treatments that we're combined. So again, I'm Dr. Joe Brown. You can always find me at drjoebrown.com or 602-421-2613 or on our back line 480-456-8600. I hope that's answering your guys' questions. Keep them coming. I'm getting literally YouTube questions and YouTube videos nonstop and different emails to me all the time, all day long. So keep them coming and I'll try to answer them just as quick as I can, okay? Again, I'm Dr. Joe Brown. Have a great day. We'll see you soon. Bye-bye.